Okay, so we're going to be looking at her shoulder girdle like bony landmarks. So first we're going to start of her turning her this way. So we're going to look at her anatomical position. And what we're going to see here is we're going to locate the manubrium. And then laterally of that, we can feel her clavicle moving all around here. And so this is going to be the sternoclavicular joint, and then the acromioclavicular joint. This is where the acromion process is. And then if we kind of find a little right here, it's a little tender there, there's going to be the coracoid process. And then if we have her turn this way, just from the acromion process and we lead down here, we can feel the spine of the scapula. And then if we start to cuff our hands like this, we can feel the medial border and the lateral border of the scapula, as well as the inferior angle. We can feel that up here. And then, yeah, I think that's all. So we're going to be focusing on stretching our left shoulder because our violin player, due to holding it for such a prolonged period of time, it causes the muscle to feel fatigued and just a lot of tension in that left upper shoulder region. So that's leading to her tightness even when not playing. So for strengthening it, so we're going to just be focusing on scapular retraction with the resistance band. Obviously we don't have a resistance band, but if we did, we could tie it to a pole or some kind of surface. We could sit or stand depending on how we're feeling that day, and then just pull the band back and really feel that tightness in the back of our rhomboids, just feeling that retraction. And we can hold that for 2 to 3 seconds and then slowly release. And then she can be doing that for 3 sets, 10 to 15 repetitions, just depending on how she's feeling that day. So it's really focusing on strengthening the middle trapezius, which stabilizes the scapula, reducing overcompensation. And then for stretching, we're going to focus on the upper trapezius because that's where she's feeling the most tension. She can be sitting or standing, and we are going to gently tilt our head away from the affected shoulder. So we're going to be tilting to our right, and then using our right hand to gently guide the head further this way, just so we can feel that stretch all along the trapezius, the upper trapezius, and all the sternocleidomastoid, and just to help relieve and stretch those muscles that she's feeling a lot of tension in. And she can do that for 20 and 30 seconds. And then for soft tissue massage, we can just have a tennis ball. I don't have one with me right now, but we can just use that and apply small pressure and just gentle pressure moving side up and down to massage those really tense spots that she's been putting a lot of pressure on. So it's just going to break up those muscle knots and alleviates tension because it's overused in those areas.
So the goal of this strengthening plan is to improve the strength and stability within the right shoulder. Something that our patient does a lot is constant adduction and abduction within her right shoulder. So this is causing a lot of sharp pain, and she most likely has pectoralis minor syndrome. So our goal is to improve stability and kind of help fix the potential coracobrachialis strain that she is experiencing. So basically just the lack of strength that is in her right shoulder is what's causing all this instability. So her constant jerking of her neck towards her right shoulder while maintaining neck flexion constantly on the left side is causing stress on both sides of her neck. So we think that this could cause, like I was saying, potential strain of the coracobrachialis muscle, and this is just because of the repeated motion that she's doing of doing a violin, doing this with her violin basically. So something that we want to do to help strengthen this, one of the exercises you can do is external rotation with a resistance band. So what you would do is you'd have the resistance band anchored somewhere in front of you, and you'd hold it like this with your arm, and you'd basically just move out like this, and you'd hold the band with your right hand, and you'd keep your elbow bent at a 90-degree angle. You'd slowly rotate your arm outward, and basically just make it really controlled, and you want to keep your elbow close to your body, and you basically just keep going like this. You return to starting position, and the best thing that she can do is do 3 sets with 10 to 15 reps in each set. And basically the rationale for this is that It would strengthen the rotator cuff muscles all throughout here, and that would help improve the shoulder stability that she's struggling with currently, and also just reduce reliance on that pec major muscle so much. Oh, that pec minor muscle, sorry. Yes.
Okay, for stretching the pectoralis minor, you should stand in a doorway and place your forearms on the door frame at a 90-degree angle. Gently step forward until you feel a stretch in the front of your shoulders. Hold for 20 to 30 seconds and repeat 3 times. The rationale behind this is it lengthens the pec minor, reducing tightness and anterior shoulder pain. And for soft tissue massage, the target is the coracobrachialis, and you should have a partner gently massage the area near the coracoid process and focus on long strokes along the length of the coracobrachialis muscle. Use moderate pressure for 2 to 3 minutes, and the rationale behind this is it relieves muscle strain caused by repeated bowing motion.
Maybe from the running.
It's okay. When the shoulder is elevated, the scapula is upwardly and externally rotated as well as elevated. When the shoulder is depressed, the scapula is also depressed, downwardly rotates, and internally rotates. With shoulder protraction, the scapula abducts, internally rotates, and slightly upward rotates. With retraction, the scapula adducts, externally rotates, and slightly downward rotates. As you can see. With shoulder upward rotation, the inferior angle of the scapula rotates, and the scapula externally rotates. And then with the downward rotation of the shoulder, the inferior angle of the scapula downward rotates. Oh my God.